Good morning, everyone, and welcome to the Health Committee. It is Wednesday, October 11th, 9:30 a.m. I'm calling the meeting to order. Please bear with me. As we gather this morning, I wish to acknowledge on behalf of committee and our community that we're meeting on traditional territory of the Algonquin Nation. We thank the Algonquin people and express our respect and support for their rich history. We're extremely grateful for their many and continuing displays of friendship. We thank also all the generations of people who have been careful stewards of this land for millennia. Ms. Johnson, has the roll been called this morning, please?
Yes, Chair, the roll has been called, and we do have quorum.
Thank you. I would invite at this time disclosure of pecuniary interest, and if any, the general nature thereof, please. I see none. I now seek a motion to adopt the meetings of two previous meetings, the first held September 13th, the second September 27th, 2023. Could I have a mover, please? Moved by Councillor Wilmer, seconded by Councillor Grills. Any errors or omissions? I see none. All in favor? That is carried. Thank you. There were no delegations at the time of meeting. At the time of mailing, Mr. Kelly, that continues to be so?
Yes, it does, Chair.
Thank you. With that then, there is no administration department report. Again, I presume that that continues to be so?
Yes, it does, Chair.
Thank you. With that then, I will go directly to Chief Nolan and the Emergency Services Department report, please.
Thank you, Mr. Chair. Through you to members of the committee. Now, item number 1 is related to mental health addictions and homelessness. And at the September meeting of committee directed my department to create a terms of reference to investigate funding opportunities to create a mobile health addiction and homelessness hub to present at the October Health Committee for approval. So the following attachment, ES1, is the basis for which the implementation will be carried out through the plan. So, Mr. Chair, recognizing that that is an appendix, would you like me to go through that with members of committee at this time, or would you like to hold that for afterwards?
I think actually we probably will dig a little bit deeper on that one, and just so that it is fresh in committee's minds, maybe we will go through the information items and come back to that one. Chief, you can take us through that because I do anticipate there will likely be some questions or comments. Thank you.
Thank you, Mr. Chair. Item number 2 is Oxford County, and we're happy to say that Oxford County, which is in southwestern Ontario, has taken time to visit our community paramedic program on September 12th, learn more about VTAC, as well as the general community paramedic program. So we're happy to invite our friends from Oxford County and have spent time with them. And we also learned a considerable amount from their experiences in community paramedicine, so happy for that exchange. Item number 3, related to paramedic services, awards and recognition. Happy to identify Commander Hultink, Amber, who will be a guest presenter at the Rural Community Hospice Day and Home Hospice of North Lanark in Carleton Place, and really happy that Amber's continued to be recognized as a leader, not only in community paramedicine, but also in the palliative care and hospice space. Amber has also been nominated by St. Lawrence College for the Premier's Award, celebrating Ontario's outstanding graduates. And the ceremony will be held at the Sheraton Centre Toronto Hotel on November 27th. So please join me in wishing Amber well in her nomination, and a congratulations to be identified by her alma mater as their most outstanding graduate as part of this process. So congratulations to Amber. Point 3 within item 3 is an article co-authored by Deputy Chief Matthew Grenier titled Violence Against Emergency Healthcare Workers, Different Perpetrators, Different Approaches in the Journal of Aggression, Conflict and Peace. And not only did Matthew publish this peer-reviewed piece, but it also won an outstanding award for outstanding paper in the 2023 Emerald Literati Awards, which is a great honor to be a part of. So big congratulations and thank you to Matthew. And then we have another Matthew, and that's Matthew Lassick, and he is an advanced care paramedic with us and community paramedic as well. and he represented the paramedic service at Recovery Day, September 23rd, in Renfrew, hosted by McKay Manor. Recovery Day was held in support of the stigma reduction and increased wellness to celebrate the many pathways to increase wellnessness in our community. So thank you to Paramedic Losick for his involvement in that. Item number 4, Mr. Chair, is the Emergency Management Program Committee, and this is a reminder for this committee that you have a secondary responsibility as it relates to the Emergency Management Program Committee, which is a requirement under the Emergency Management Act to validate our emergency management plan, but also to exercise on an annual basis so that our emergency plan remains relevant to our community, but also I think in our case also relevant to our unique role in playing the upper tier responsibilities versus the local municipal responsibilities. And I think that there is some nuance there that we will be covering today. So I look forward to that meeting after Health Committee meeting today. And then item number 5, Mr. Chair.
Actually, if I might, Chief, I think, these are resolutions. The heading was not there. So before we get into resolutions, I think we will return to the information items and address items 1 through 4 before we get into the resolutions. So I am going to go back to item 1, and as somewhat of a departure from typically, as we had deferred any of your presentation or discussion on the draft terms, I would invite committee to turn to Appendix ES1, that is on page 10, and I would yield the floor to you on this one, Chief.
Thank you, Mr. Chair. And so we'll return to the resolutions after this
That's correct.
portion. Thank you. So item ES1, as it pertains to item number 1 in today's report, it's a bit of a backgrounder here for you in terms of the issues as it pertains to mental health addictions and homelessness. And I'd be remiss in not sharing not only the strategic responsibility for this, but the incredible work that Laura and her team have done in the space around homelessness. So her team and my team are working shoulder to shoulder in better understanding the issues and being able to explain the issues as it pertains to mental health addictions and her area of expertise as it pertains to homelessness. So a big thank you to Laura for that work, and Laura is absolutely the corporate expert as it pertains to a significant portion of the issues in today's terms of reference. So Laura, please join me at any time that you feel appropriate to add in, Mr. Chair, if that's acceptable to you.
Absolutely. I am most open and approachable.
Thank you, Mr. Chair. So in terms of the background, and I'll not read it for you, but some of the statistics here are really putting a lens on the impact as it relates to homelessness, mental health, and addictions in Renfrew County. This is a pan-Renfrew County issue that is often not spoken of. Certainly the warden and his career in crisis mental health work also lends itself to understanding the legacy of this issue, but also where we're at today, because we know that from our friends at the Ottawa West Four Rivers Health Team, 35% of emergency department visits are related to mental health and addictions. From a paramedic service perspective, we're still in the process of fully understanding the impact of mental health and addictions as a driver for service within the paramedic service. However, we do know that there's been a 75% increase in opioid-related deaths in 2021, revealing the severity of the overdose crisis, and we know that that continues to not only be present, but continues to rise in our community. When we look at this in terms of other jurisdictions and their acknowledgement of the issues related to mental health addictions and homelessness, there was a mental health well-being response team stood up over the past 8 months in Ottawa, and they've been able to show that by having a community paramedic and a crisis social worker working together, they've been able to have a 66% reduction in emergency department visits by that population. So leaning into serving these people where they are and when they need appropriate care. So these are incredible results from that team, working with Craig, the EOWC, and AMO. There are a number of models that are starting to emerge across Ontario that all have a similar community paramedic and allied health provider lens in being able to support this population where they are. And in some cases, those are encampments based on homelessness. In some cases, those are in secure facilities. In other cases, VTAC has been playing an important role in being able to support this population, which by and large is unattached to primary care as well. So you can imagine the opportunity that may exist there. So when we look at next steps in terms of this terms of reference, we worked very closely with Laura's team as well as public health and other agencies that are listed within these terms of reference. But we've identified that the gathering of a list of resources and contacts, developing clear referral processes between agencies and self-referrals, developing an MOU so that we can have good data and be able to share information between our agencies, developing consent, determining the services that are required, developing clear goals for the program. And this is a little bit mercurial given the nature of mental health, addictions, and homelessness. But as you can see in Laura's information that's been shared on page 11, certainly there's robust data in terms of homelessness. But as Laura's staff identify, these numbers could be 40% higher than what's reflected in the census, given the fact that there may be some transient populations involved, and not having an address makes it particularly difficult to be able to wrap our heads and arms around this population. Is that fair to say, Laura? Yeah. So when we look at this in terms of stakeholders, we've identified a list here of folks that are already playing an agency role, either individually, and in some cases there have been some tables set around addictions, for example. But Renfrew County and District Health Unit, the Community Services Department, RCVTAC, and the paramedics, the Algonquins of Pikwakanagan, Renfrew County Addictions Treatment System, Ottawa Valley Health Teams, Ontario Addictions Treatment Centres and the role that Pembroke Hospital has to play in that, and as well Four Rivers Ottawa West Health Team has certainly prioritized mental health as their #1 area of concern and of priority, and they have a number of different projects that are ongoing now, which is why there's an opportunity for collaboration, for example, with the Ottawa Paramedic Service, Queensland Carleton Hospital, and as well the Iron Prayer Hospital. So when we look at this in terms of goals, Mr. Chair, connecting clients, leveraging programs, alignment with our county priorities and our strategic goal about supporting sustainable programs and funding for VTAC, as well as community paramedicine and mental health. And certainly Laura's team has done an exceptional job in the space of homelessness, and I think that she would agree there's continued opportunity to further collaborate between programs and as well leverage provincial funding and the expertise that she has in supporting that population. So we need to look at expanding models of care, improving access to services, and ultimately partnership with allied agencies and OHTs to optimize that expertise and available resources. And I think, Mr. Chair, it's important to double back in terms of the paramedic service interest in this, and it's identified in the goals, and that is that mental health, addictions, and homelessness has had a sharp rise in the pressure on our paramedic service, and the paramedics have continued to stand up to that, you know, when you think of overdoses, for example, but there are also significant mental health crises where paramedics, in collaboration with the expertise in Laura's department, public health, and others, can do a better job in supporting people, keeping them in the community, but also making sure that they have access to quality services in Renfrew County. So we look forward to continuing our work in this area, Mr. Chair.
Thank you very much, Chief. So back to committee on item number 1. Any questions or comments? Councillor Nicholson, please.
Thank you, Chair. I'm just wondering if we can get some updated statistics specific to opioid-related deaths or impacts directly here within our territory. Is that possible?
So is that like in reference to the third bullet point? Because I was curious about that too, and it's a 75% increase since 2021. I wonder, Chief, if you might have any more granular information on that?
Yeah, thank you, Mr. Chair. And I'd be happy to get back to committee with, I think, a robust scope of data that allows us to better understand the issue as it pertains to Renfrew County, and then any hotspots within Renfrew County related to mental health and addictions. Certainly Laura's team, I think, would be best to be able to bring forward some up-to-date census in terms of a homelessness component, but also other services that may be available or being used. I know Laura's been signaling for some time that where we have economic changes in the status of our population, there are increased drivers for service. Laura, do you want to add to that, Mr. Chair, if you're comfortable with that?
Absolutely. Ms. Lapine, please.
Thank you. And through you, Chair, to committee, I can concur with what Chief Nolan is saying. We have reached out to quite a few different services throughout the county. We're working with quite a few different sectors because the situation in terms of homelessness also includes mental health and addiction issues as well as other issues. So we certainly can bring back data as it relates to Councillor Nicholson's question and seek out further data through the health unit on some of the other impacts that opioid use and other factors may have. Thank you.
Thank you. I just before I note Councillor Murphy will be next. I just this is some pretty stale dated information, but I think it is probably jarring the difference. This is a publication. Just bear with me 1 minute. This was put out by Public Health Ontario and ICES in 2012. And I think in retrospect, it might actually be considered quaint. In this one, it was suggesting that in Ontario, they were projecting in 2004 through 2012, I think, on average, about 350 opioid deaths per year, though a 2008 National Survey on Drug Use and Health was suggesting that the number was substantially higher than that. But I think that, once again, this publication was from 2012, and I want to be very careful not to be perceived as being flip in any way, but in terms of where the opioid epidemic has gone, this seems to be the good old days, if you will. Do we have any estimates on so the homelessness component of this? I'm not sure that Ms. Lapine's department is tracking the physiological and health impacts. Do we have any data on what we're seeing from the paramedic service?
Yeah, thank you, Mr. Chair. And I think that, as I said previously, I'd like to be able to bring this back in the fulsome context because it's alarming to me in terms of our individual notifications within the paramedic service on a day-to-day basis. There isn't a day that goes by where paramedics aren't responding to overdoses within the county, and that is shockingly alarming to me. The fact that that a significant portion of those overdoses are resulting in death or unconsciousness or in some cases resuscitation by the paramedics has become almost commonplace within our communities. And I think that while the 2012 data paints a picture, I am reticent to kind of fill out that canvas, if you will, right now in Renfrew County because the numbers are so staggering and have increased so sharply over the past 24 months that I'd be happy with your direction to bring back statistics to Councillor Nicholson's request at the next Health Committee meeting and provide a fulsome report in that status. I think Laura's data is very important to be able to understand that as it pertains to homelessness and any other access to social services in the county. But when we look at opioid versus non-opioid related overdoses in the county, we're almost at a draw in terms of the equivalency between opioid and non-opioid. However, the number of deaths have increased significantly over the past 6 to 12 months in Renfrew County, and those are predominantly related to opioid-related overdoses. So I'll be happy to bring that data back to you, sir. We can compare it to the 2012 experience, but I think almost on a month-over-month basis right now, the escalation and increase related to overdoses and opioid-related deaths in Renfrew County will paint a very stark picture for all of us in terms of the immediacy of this issue and the complexity of this issue as we go into the winter months.
Thank you, and I would concur that that having good, solid numbers would be the appropriate thing. Is that, Councillor Nicholson, what you were seeking? For the purposes of the recording, I wonder if you might...
Yes, thank you.
Thank you. Thank you. So I don't know if, Mr. Kelly, do we need to have committee give direction for that, or is that something that's simply at the request of Councillor Nicholson?
I think, to you, Chair, I think that the chief plans a regular update in the ongoing situational analysis of what's going on in the county, so I'm confident that he will include this in this upcoming reports, and I don't think a motion is required in this particular case.
Okay, thank you very much. So, Chief, I think you can take that as direction. It's simply the request we would perceive as direction then. And I'm just wondering, too, this conversation right now, this is the explicit mission statement of CAMH, the Center for Addictions and Mental Health. And perhaps there is even some comparative data that we could be bringing forward from a broader perspective as comparing our experience. It just seems to me that for a lot of reasons, what seems to have been an explosion in opioids and opioid-related deaths, and all of the challenges, even in, as you're acknowledging, the paramedic service for some time, right up until now, having the first new car, 24-hour car, in I don't know how many years, because we had expended all of the efforts in mitigating against some of the challenges we're seeing, and it seems like this now is a burgeoning challenge for the paramedic service as being the first responder from a health perspective. So I think that data would go a long way towards informing what appropriate steps would be moving forward. Councillor Murphy.
Yeah, I asked the exact same question at the health unit meeting last week, and basically they're saying the same thing, Chief, that there's so many agencies, as Laura said, that are dealing with these opioid-related, not necessarily deaths, but overdoses, that you might not even be putting your hands on if a family member takes somebody to the hospital. Or so they're even having difficulty trying to quantify because of the several agencies. I'll be very interested to hear your report. Thank you.
Thank you, Councillor Murphy. I think that it probably is not going too far out on a limb to suggest that we are, if not already immersed in, bordering on epidemic. So I think that this is something the health unit and community services and the paramedic service will be wrestling with. Councillor Murphy, follow up?
Dr. Morgenstern did call it an epidemic.
Thank you for confirming that. Any further questions or comments? Warden.
Thank you. This approach, the mobile approach, I think, is probably the best for us, given that we have such small pockets of population and I don't mean this disparagingly, but small pockets of people in need. We're not able to concentrate them to gain efficiencies by having one person serve 40 people in a day. So it makes sense, and I think the chief is quite correct. Most of these folks also have underlying medical issues that haven't been addressed for years. By that overlay of medical issues, they often become distracted or anxious about them and aren't able to concentrate on fulfilling their obligations or their plan to move into a place to stay or to take greater care of their mental health issues. So I think it's a ground up approach in terms of establishing a relationship and then also ensuring their health before they can move on to the other pieces of their lives. So I think it's an often overlooked piece, but it's been my experience and experience of others that when you get into an interview, all of a sudden it's not only about homelessness, it's not about relationships that aren't there any longer or missing appointments. It's about a worry about chronic heart issues in the family or their own issues that 5 years ago some doctor in ER told them about and they've never gone back to check on. So I think this makes a lot of sense because it gives them a foundation for some success.
Thank you. Anything further? Councillor Nicholson.
Chair, I just I was going through the list of stakeholders there, and I note that we don't have police services there. Is there consideration for not including them, or is that just simply an oversight at this point?
Chief?
Yeah, thank you, Mr. Chair, and through you to Councillor. Really the front of mind list was created based upon the health lens, and we know that of late the Solicitor General has been funding paramedic or police services for other allied health to be joining them in some responses through their mental health crisis teams. I certainly am open to the addition of the OPP, especially their mental health crisis team workers, as part of our stakeholder group in the planning of this. While it wasn't an oversight, I think that the intersection between criminality and health is becoming increasingly blurred with the role that's being supported through the Solicitor General's office. However, I do see them as a valuable partner, not only in the planning phase, but also in the operationalization of this community hub model as it's being proposed today.
So, given that, am I correct then, Councillor Nicholson, in inferring that you are suggesting that that would be an appropriate inclusion?
Yes, I think based on what the Chief just said, I would be in support of that.
Okay, and I'm going to defer once again. Procedurally, Mr. Kelly, this is not a resolution that's before us, and it is certainly a draft or even a broad brushstroke, if you will. Is that something that would need to be by resolution, or is it just by discussion? Your response, Mr. Kelly.
No, thank you, Chair. So, while now marked draft in big bold letters, these are draft, as you've mentioned. At some point when they're fully fleshed out, then the Chief will be bringing these back with a full resolution to adopt these as the terms of reference as we start meeting with our peers and again putting more details to them. So I think inclusion of the OPP is actually something we just talked about briefly yesterday, because there was some new funding announced for a similar approach for many police forces across Ontario. So the point was noted. I would count it as an omission, and we'll include that moving forward. That's fine.
Okay, so where it perhaps was made as a recommendation, it can certainly be, I'm perceiving that the Chief and yourself are recognizing that there would be a valuable component or a valuable consideration brought to the initiative. Okay.
Yep.
And follow-up, Councillor Nicholson.
Thank you, Chair. I appreciate resolving that one issue. If I could propose another one?
You can, but I would like you to identify how many you have. Like, the steady drip one at a time is okay, but are there 10 of them?
No, and I'm taking my turn to make sure everybody else has the floor as well.
All right, thank you. Do continue.
I just wanted to note, I acknowledge what the warden's comments about the mobile nature of this initiative, and I think that suits our geography very well, being able to move to where the issue is. But I also recognize that there are going to be communities within the county that are going to have to deal with this stuff, deal with housing and homelessness, as an example, very closely. And I just want to make sure that we don't lose sight of that in this terms of reference, that there is an inherent responsibility for this organization to work with those communities who are providing the supports on the ground, whether that's a not-for-profit, whether that's a municipal not-for-profit partnership. This mobile unit is going to have to integrate into that community organization. And I just want to make sure that we don't lose sight of that in these terms of reference. Thank you.
Thank you. Mr. Kelly, you wish to respond?
No, thank you, Chair, and through you to committee. So it's a good point to raise it, because there's this dangling participle, I guess, if you want to call it that. So committee will recall that a member of Councillor Purcell was going to bring a notice of motion today regarding a warming centre or shelter or otherwise. Through the last few weeks, that motion rests with the Community Services Committee as an item to be considered with that committee, because Community Services as as a department of the county funds centers and shelters. That said, I've had conversations with the member of the committee on pausing that, or at least the member of the committee is asked to pause that notice of motion until he seeks approval from the City of Pembroke. And that will be on the warming center and shelters and otherwise. So I think more to your point, we recognize that shelters and warming centers play a role, but I think that best may be left for that conversation to be had when Councillor Purcell brings that, or committee member Purcell brings that forward, and I'm assuming next month or when appropriate.
Okay, thank you, and I do appreciate that, and Councillor Purcell, I believe that you have been in communication with Mr. Kelly just to find the proper lane, if you will, and I think that you have landed on. I certainly struggled with that even after our committee meeting, and I will note that Councillor Purcell did in fact provide notice of his intent to bring forward a resolution, but I think, and certainly the reason that both Councillor Purcell and Councillor Lafreniere sit on this committee, as does the City of Pembroke on the community services, is it is a shared service. There is funds, there is funding that the City of Pembroke provides for the services delivered through this committee and delivered through community services. But because of the duality, I think that as an initiative of the city or endorsed by the city, I think that would be a very practical proposal. So I do look forward to that, and I recognize that there is the larger issue that we are beginning to embark on addressing through this mobile response, if you will. And I think that is probably the foundation, but I'm thinking that it might look like something else as we're continuing. But there is also a more pressing need, given the climate that we inhabit. And I think that is the other discussion, and I think that's what you were talking about, Councillor Nicholson. Is that correct?
Yeah, thank you, Chair.
Okay, thank you. Anything further on item number 1? That's right, we're still on item number 1. Okay, bear with me one moment. Item 2, Oxford County visit. Item 3, the Paramedic Service Awards and Recognition, and as it is stated certainly in black and white in front of all of us, I also want to extend my congratulations and appreciation to Commander Hultink and wish her well at the ceremony in Toronto, and on behalf of her alma mater as well. I think also perhaps at a future Health Committee meeting, Chief, that consideration be given to a delegation from the commander with respect to the fully embrace that she has for hospice and palliative care. I think that it demonstrates the multi-pronged approach that we have with respect to the community paramedicine, and how engaged it is in our communities, and reflective of the fact that palliative care is an enormous part of our full health care from cradle to grave. And I think that it speaks volumes to the level of service that is provided through community paramedicine. And also, of course, to Deputy Chief Grenier and to ACP Lasik on their work as well. Any further questions or comments? I see none. Item 4, the Emergency Management Program Committee. Any questions or comments? I do note that at the conclusion of the Health Committee, we will be taking up the exercise. So looking forward to that. If there is nothing, Councillor Weir, please.
Yes, thank you. I noticed when I was reading through this that tabletop exercise is planned for the day after this meeting. Never received a calendar request or anything for that, so I didn't know whether or how long it's going to take, and because I didn't put it into my calendar, I'm just wondering what is the timeline we're looking at for that today.
Okay, I'll speak first. I can't recall if there was a specific timeline on the invite, but the plan itself was distributed as a separate item. You did receive that, Councillor Weir? Okay. Chief Nolan, can you speak to Councillor Weir's question then?
Happy to, Mr. Chair. So, to the Councillor, it's within the Health Committee time envelope. So we will be done by 11 o'clock is the intention, so that we will complete the emergency management portion between 11 and 12. So as not to layer on your calendar, it's within your anticipated time in the chambers.
Thank you very much.
You're welcome.
Anything further on item 4? Okay, then we'll go to resolutions, please, Chief Nolan.
Thank you, Mr. Chair. Shall I read the recommendation?
Please.
That the Health Committee recommend the County Council approve a delegation request to the 2024 Rural Ontario Municipal Association Annual Conference with Honourable Sylvia Jones, Minister of Health, to discuss a mental health and addictions and homelessness paramedic strategy, and further that the chair of the standing committee along with the warden be designated to attend the delegation. There's a background there for a committee, Mr. Chair.
Thank you, Chief Nolan. Can I have a mover, please? Councillor Murphy, seconded by Councillor Nicholson. Discussion. I think that the background is straightforward. Discussion. I think that there's a fairly unique opportunity, just based on the conversation we had on item number 1 with respect to the OPP and their engagement on this. So prior to Ms. Jones becoming the Minister of Health, she was in fact the Solicitor General. She was the Solicitor General when the initiative for the community safety and well-being plans were rolled out across the province. So I anticipate that we're fairly uniquely positioned, should we be awarded a delegation with the Minister of Health, that there is that component that she will be fairly familiar with, that might yield some success on this. So I think that there's a fairly unique opportunity here. If there's nothing further, I will call the question. All in favor? That is carried. I now seek a motion to approve the emergency services report as a whole, please. Councillor Nicholson, seconded by Councillor Weir, rather, seconded by Councillor Wilmer. Any further and final question? All in favor? That is carried. With that, then, we're going to go directly to Mr. Blackmore and the Long-Term Care Department report, please.
Thank you, Chair Donahue. Through you to committee, good morning. Your report begins on page 13. The first item is details a public health inspection conducted on August 30th by Inspector Ola Ostifchuk. There were 4 areas of noncompliance identified for which a plan of correction was initiated. There was one area of repeat noncompliance specific to some cupboards that were identified early on as being chipped. An attempt was made to paint as a repair. It wasn't the end result we were looking for. So anyhow, we're in the process of obtaining quotes to replace the cupboards. The second information item summarizes the recent inspection conducted at Bonnetry Manor by the Ministry of Long-Term Care from August 17th to August 23rd. The inspection was in follow-up to complaints that had been received, for which there was a written notice received for failure to report a written complaint to the ministry immediately. And in a related instance, there was an instance of alleged abuse. The matters were dealt with immediately, however, reported the next day, so resulting in the non-compliance. Just in summary, following our investigation, the employee that was involved in this instance no longer with us, employed. Item number 3 is a notice of our upcoming volunteer recognition event planned for Bonnetry Manor on October 18th and Miramichi Lodge on October 20th, for which Warden Peter Emo, Health Committee Chair Michael Donahue, Chief Administrative Officer Craig Kelly will attend to offer their greetings and appreciation on behalf of the County of Renfrew. Item number 4 is to inform committee regarding staffing changes to both homes to provide coverage for Administrator Dean Quaid's parental leave. Dean's going to be away until December 27th. So as is required per the Long-Term Care Homes Act, we need to name a administrator designate. Nancy Lemire, Director of Care for Miramichi Lodge, will be sitting as the acting administrator for Miramichi Lodge, and I will be moving down to Bonnechere Manor for that period to be the cover administrator role at the manor.
We'll pause there before we get into resolutions. Committee, I will return to the top of page 13, information item number 1, Renfrew County District Health Unit Inspection Report on the manor. Any questions, comments? Item 2, the Ministry of Long-Term Care Inspection Report on Bonnechere Manor. The report, there is a hot link to the report. Item 3, the annual volunteer recognition. Very pleased actually to be attending once again. I think last year, 2022, was the resurgence of the in-person volunteer recognition. I believe I painted a rock at each of the volunteer recognition, and it's incredibly important to recognize the volunteer component in long-term care. It is essential. It is an essential service. And it does provide that link, that community embrace, both for the residents of our long-term care facilities to be part of the larger community, but also that the larger community is recognizing this unique presence of long-term care residents within the larger community. So looking much forward to these events going forward. Item 4, the acting administrator at Miramichi Lodge. Seeing none, moving on to resolutions then, please, Mr. Blackmore.
Thank you, Chair. Through you to committee, a resolution for seeking approval to proceed with hydronic system upgrades with funds marked for this purpose in the 2023 capital budget. A recommendation that the Health Committee recommend to County Council that County Council award the hydronic distribution system Phase 4 project as per the County of Renfrew GA01 procurement of goods and services policy section 20.7 for the quoted price of $143,029.47 excluding HST to Honeywell Limited for the replacement of hydronic controllers for the BAC net controllers, which was approved through the Miramichi Lodge 2023 capital budget, and further that the Finance and Administration Committee be so advised.
Thank you, Mr. Blackmore. I would seek a mover, please. Councillor Murphy, seconded by Councillor Grills. Background, please, Mr. Blackmore.
Thank you, Chair. Through the committee background, the sum of $160,000 was approved through the Miramichi Lodge 2023 capital budget for the hydronic distribution system Phase 4 project. The existing Honeywell building automation system is designed to be used with Honeywell brand actuators. Pairing the upgrade actuators with the building automation system that is designed for ensuring tempered air is paramount. Honeywell Limited was the original installer and maintains a comprehensive contract for this equipment and provided a total project cost of $143,029.47 excluding HST for the replacement and upgrade of 179 XL10 hydronic controllers to BAC net controllers of type CPO-RS5 in all 3 wings, A, B, and C, and on all floors, as well as 1 RIO-LON controller in the mechanical room of the 2nd floor to be replaced with a CPO-RL5 controller, which will increase comfort and provide energy savings. Procurement of Goods and Service Policy GA01 Article 22.1C supports that where only one source of supply would be acceptable and or cost-effective due to compatibility or safety and liability concerns, the requirement for competitive bid, solicitation for goods, services, and construction may be waived under joint authority of the appropriate Director and Chief Administrative Officer. Corporate Policy GA01 Article 20.7 identifies awards emanating from a request for proposal that exceed $150,000 requires the approval of County Council. Staff is seeking committee's recommendation to County Council to award this project to Honeywell Limited.
Thank you, Mr. Blackmore. And certainly I'm aware of the challenges to meet our current needs of the 179 XL10 controller and the Rio Lawn controllers, and I'm very pleased I've heard nothing but glowing reports about the C-3PO R2-D2 controllers. So I'm very pleased that we're finally making these upgrades. Any further questions or comments? Councillor Murphy.
I was actually going to ask for an in-depth report on what these mean, but knowing that we have emergency management, I'll let it go.
Thank you, Councillor Murphy. Any further questions or comments? Seeing none, all in favor? That is carried. Thank you. And moving on to item 6, please, Mr. Blackmore.
Thank you, Chair. Through to committee, item number 6 is a resolution seeking approval to proceed with signing authority. A recommendation that the signing authority for Bonnechere Manor Trust accounts be updated to remove Sandra Block and add Kim Prentice effective October 11, 2023, and further that 2 of the following 5 names have signing authority: Jeffrey Foss, Mike Blackmore, Dean Quaid, Shiji Patel, and Kim Prentice.
Could I have a mover, please? Councillor Weir, seconded by Councillor Wilmer. Background, please.
Thank you, Chair. With background with over 25 years of service with the County of Renfrew, Administration Supervisor Sandra Block retired effective August 31, 2023. We wish her a long and healthy retirement. For the purposes of continuity and the promotion of standardized administration practices between the homes, the Administration Supervisor role has been consolidated into one position. Going forward, Kim Prentice will assume the Administrative Supervisor role for both Bonnechere Manor and Miramichi Lodge.
Thank you. Questions, comments? Certainly wish to extend Ms. Block deepest appreciation. Another member of the Quarter Century Club departing. We are losing quite a bit of institutional memory over the next short while. Very pleased to have had her services all this length of time. Once again, any questions, comments? All in favor? That is carried. I believe that concludes the report. I'd seek now a motion to accept the long-term care report, please. Councillor Purcell, seconded by Councillor Nicholson. One further and final opportunity on any item before us. Seeing none, all in favor? That is carried. Thank you. Returning to the agenda found on page 1, item 10 is the Board of Health minutes. I'd seek a motion to, I think, receive. Is that the standard? Receive. Thank you, Mr. Kelly. Seek a motion to receive the minutes of the Board of Health from their special meeting held July 25th, 2023. Councillor Purcell, seconded by Councillor Murphy. Any questions or comments? Seeing none, all in favor? That is carried. Is there any new business to be brought forward today? I see none. Mr. Kelly, once again, there was no closed meeting at the time the report was distributed. Does that continue to be so?
Yes, it does, Chair.
Thank you. The date of our next meeting shall be Wednesday, November 15th, 2023. The emergency exercise is happening outside of the auspices of the committee itself, so we will be adjourning. That is correct?
That is correct, sir.
Thank you, Mr. Kelly. With that, I'd seek a motion to adjourn, please. Councillor Grills, seconded by Councillor Weir. All in favor? Thank you. We are adjourned. I think that might actually be a record.